There was a time not that long ago when you didn't think twice about your heart. You got up in the morning, made your coffee, and just lived. No pill organizer, no 3 bottles lined up on the kitchen counter, no lying awake wondering if something is quietly going wrong inside your chest. But now, every single morning, you're swallowing Amlodipine, Losartan, Lisinopril. And somewhere in the back of your mind, a question you're almost afraid to ask out loud: are these pills actually helping me, or are they slowly hurting me? Here's what I need you to know right now. Millions of Americans over 60 take these exact 3 medications, and most of you, have never been told about a dangerous daily habit that could be making every single one of these pills stop working, or about a combination risk that could send your heart into a dangerous rhythm without a single warning sign. Today, I'm giving you 9 things your doctor should have told you at that appointment but probably didn't. And stay with me until thing number 7, because that one thing, the one almost every doctor skips, may finally explain why you feel dizzy every morning, exhausted every afternoon, and why your ankles look like they belong to someone twice your size by dinner time. Don't skip ahead. Every single one of these 9 things builds on the last. Let's start. My name is Dr. Alan Mandel, and for over 30 years I've spent my career doing one thing: helping Americans over 60 live longer, stronger, and more independent lives. Heart health, blood pressure, medications. This is what I do every single day. And I want you to know something. The confusion you feel about these 3 medications, that is not your fault. Most doctors have 7 minutes with a patient, 7 minutes to diagnose, prescribe, and move on. Nobody sits down and actually explains what these pills are doing inside your body. That stops today. If you want a doctor who takes the time to truly explain things, hit that subscribe button right now and tap the bell. I post new videos every single week just for seniors like you. I want to tell you about Dorothy. Dorothy is 69 years old, lives in Nashville, Tennessee, retired school librarian, proud grandmother of 4, still volunteers at her church every single Saturday morning, the kind of woman who has always taken care of everyone around her before she ever thinks about taking care of herself. About 2 years ago, her doctor put her on Amlodipine, Losartan, and Lisinopril for her blood pressure, and at first she didn't think much of it. She trusted her doctor, she took her pills every morning without fail, and her numbers at the office looked fine. But somewhere around month 4, a dry, scratchy cough started that just would not go away. Her doctor said it was probably seasonal allergies. Then her ankles started swelling by mid-afternoon, puffy and tight like she'd been on her feet all day even when she hadn't. And then came the dizzy spells. Standing up too fast from her kitchen chair one Tuesday morning, the room tilted, her hand shot out and grabbed the door frame just in time. And the question that kept her up that night, the one she was almost too scared to say out loud, was this: if my doctor says my blood pressure is under control, then why do I feel like I am falling apart? Dorothy is not alone. I hear this exact story 2-3 times every single week in my office, and I promise you every answer she needed and every answer you need is coming up right now. Alright, let's get into it, and I want you to stay with me here because understanding what each one of these 3 medications is actually doing inside your body is the foundation of everything else we're going to talk about today. So let's start with Amlodipine. Now, I don't want you to think about chemistry or complicated medical words. I just want you to picture a garden hose. When that hose gets a kink in it, the water pressure builds up behind the kink, right? That's what happens inside your blood vessels when they tighten up. Amlodipine is the medication that goes in and gently relaxes that kink. It loosens the walls of your blood vessels so your heart doesn't have to push so hard to move blood through your body. Simple as that. But here is what most doctors never tell seniors specifically, and this is important. Your body over 60 processes amlodipine more slowly than a younger person's body does. That means it stays in your system longer, it builds up more, and the side effects hit harder. And amlodipine causes one very common problem that almost no senior ever connects back to their pill. I'll tell you exactly what that problem is in just a few minutes, so don't go anywhere. Now let's talk about lisinopril. If amlodipine relaxes your blood vessels, lisinopril works a completely different way. I want you to picture a water balloon that someone is squeezing too tight. Lisinopril is the medication that releases that squeeze. It blocks a chemical in your body called ACE that tells your blood vessels to tighten, and when you block that chemical, the pressure comes down. Now here is the part one need you to really hear, and Dorothy, our librarian from Nashville, she heard this, and the relief on her face was something I will never forget. That dry, scratchy, won't go away cough that she'd had for 8 months and blamed on allergies, that cough was the Lisinopril. It is one of the most well-known side effects of this entire class of medication. It affects up to 1 in 5 seniors who take it, and yet patients go months, sometimes years, being told it's allergies or a cold or acid reflux. If you have that cough, you are not imagining it, you are not being dramatic, and there is absolutely another option your doctor may not have offered you yet, and we will get to that. Now, before I tell you about the third medication, I want to ask you something quickly. If this video is already opening your eyes, if you're already connecting dots you've never been able to connect before, please hit that subscribe button right now and join our community, because next week's video is one you absolutely cannot miss either, and I don't want you to miss a single one. Okay, Losartan. Losartan is what we call an ARB, but forget that word. Here's all you need to know. Think of Losartan as a bouncer standing at the door of your blood vessels. Its entire job is to block a chemical called angiotensin from getting in and raising your blood pressure. It does a similar job to Lisinopril, but in a different way, and for many seniors it is actually the gentler option with fewer side effects. But here is the thing that stops me cold every single time I see it in a patient's chart, and I need you to listen very carefully right now. Some seniors are being prescribed both Lisinopril and Losartan at the same time, and that combination can cause your potassium levels to rise to a dangerously high level. So right now in this moment, I want you to think about your medication bottles. Are you on both of these? Because if you are, thing number 5 coming up in just a few minutes is not optional for you, it is urgent. Now we are getting into the territory that I genuinely believe could save your life, and I am not saying that to scare you. I am saying it because I have seen what happens when seniors don't know these next 2 things, and I never want that to happen to you. Thing number 4 is something Dorothy experienced firsthand, that Tuesday morning when she grabbed her door frame to stop herself from falling. What was happening to her has a name, orthostatic hypotension. But forget the name, here is what it actually means. When you are sitting or lying down, your blood pressure settles at a certain level. The moment you stand up, your body is supposed to quickly adjust and push blood up to your brain. But when you are taking amlodipine combined with Losartan or Lisinopril, that adjustment can happen too slowly, your blood pressure drops too fast, the blood doesn't reach your brain in time, and the room spins. And here is the number that should stop every senior in their tracks. Falls are the number 1 cause of injury-related death in Americans over 65. A single dizzy spell, 1 grabbed door frame, 1 misstep, and a broken hip can take away the independence you have spent your whole life building. So starting today, every single time you get up, I want you to use what I call the sit, pause, stand method. Sit on the edge of your bed or chair first, wait 10 full seconds, then stand slowly. That 10 seconds could be the most important 10 seconds of your day. Now thing number 5, and this is the answer to the question I asked you at the very beginning of this video. Both Lisinopril and Losartan raise the potassium level in your blood. And as we age, our kidneys naturally slow down and clear potassium less efficiently, so it quietly builds up. And here is the terrifying truth. You can have a dangerously high potassium level and feel completely normal, no symptoms at all, until your heart develops a life-threatening irregular rhythm without a single warning. Bananas, potatoes, tomato juice, and salt substitutes are loaded with potassium. Please ask your doctor for a simple blood test at your very next appointment. Now I want you to think about the last time you had a headache, or a sore knee, or a stuffy nose from a cold. What did you do? You probably drove to Walgreens or CVS, walked down that familiar aisle, grabbed something off the shelf, and never thought twice about it. And I completely understand that. Those medications are right there, no prescription needed, they've worked for you for years. But here is what nobody put on that label, and what your doctor most likely never mentioned. Some of the most common over-the-counter medications that seniors reach for every single week can block all 3 of your blood pressure pills at the same time. Ibuprofen, naproxen, The Advil and Aleve that so many of my patients take daily for arthritis pain, these are NSAIDs, and they cause your body to retain sodium and fluid in a way that directly fights against everything amlodipine, Losartan, and Lisinopril are trying to do. Decongestants in cold medicines like Sudafed and Nyquil tighten your blood vessels, the exact opposite of what your medications are working so hard to achieve. You could be taking your 3 pills faithfully every single morning and still walking around with dangerously high blood pressure, simply because of something sitting in your medicine cabinet right now. I want you to do one thing after this video. Open that cabinet, look at every bottle, and if you see ibuprofen, naproxen, or a decongestant, call your doctor before you take it again. But the biggest mistake I see seniors make is not at the pharmacy, it happens right inside the doctor's office, and that is thing number 7, coming up next. This is the one I promised you at the very beginning of this video, the thing that most doctors never explain, and I need you to hear every single word of this because it may be the most important minute of this entire video. Here is what happens to millions of seniors every single year. You go to your doctor's appointment, you sit in that waiting room, maybe you are a little nervous, maybe the nurse rushes you in, wraps that cuff around your arm and takes your reading, and the number is high. So your doctor increases your medication. You go home, you take the higher dose, and suddenly you feel exhausted by noon. Your thinking feels foggy. You are dizzy again, and you just cannot understand why you feel so terrible when your doctor says your blood pressure is perfectly controlled. Here is why. That reading in the office was not your real blood pressure. The anxiety of just being there, the white coat, the clipboard, the rushed appointment can spike your blood pressure by 15, sometimes 30 points above what it actually is at home. This is called white coat syndrome, and it affects up to 60% of seniors. Doctors see a high number, they increase the dose, and now you are over-medicated. Your blood pressure is being pushed too low at home, and your body is screaming at you through fatigue, brain fog, and dizziness. The fix is simple, but it requires you to take action. Buy a home blood pressure monitor, rest quietly for 5 minutes before every reading, take it at the same time each morning before your medication, write down every number for 2 weeks, and bring that log to your next appointment. That piece of paper is more valuable than any single reading taken in a rushed 7-minute office visit. If this just answered a question you have been carrying around for months, please share this video with someone you love who takes blood pressure medication. And subscribe right now so you never miss another video like this one. Remember Dorothy's ankles, puffy, tight, swollen by 3 in the afternoon every single day. I want to talk about that right now because I cannot tell you how many seniors have sat across from me in a panic, convinced their heart is failing, convinced something terrible is happening, when the real answer is far simpler and far less frightening than what they imagined. Amlodipine, that first medication we talked about, the pipe relaxer, causes ankle and foot swelling in a significant number of seniors who take it, and it happens because the medication relaxes the tiny blood vessels in your legs just a little too well, allowing fluid to pool down there by the end of the day. Here is how you know the difference between amlodipine swelling and something truly serious. Amlodipine swelling affects both ankles equally. It is worse in the evening, and most importantly, it comes without chest pain, without sudden weight gain of 2 or more pounds overnight, and without any shortness of breath when you lie flat. Those last 3 signs, chest pain, sudden weight gain, breathlessness lying down, those mean call your doctor today. But swelling alone in both ankles, worse at night with no other symptoms, that is almost certainly your amlodipine. Elevate your legs in the evening, reduce your sodium, and have a calm conversation with your doctor about adjusting your dose. We are almost at the finish line together, and I saved this one for near the end on purpose, because this is not about fear, this is about power. Knowing these 6 warning signs means you are never caught off guard, never sitting at home wondering if what you are feeling is serious or not, never waiting too long because you were not sure. So write these down, put them on your refrigerator, text them to your adult child right now. Warning sign number 1, sudden severe muscle weakness that comes out of nowhere. Number 2, your heart feels like it is fluttering, skipping, or beating irregularly. Number 3, your home blood pressure reading drops below 90 over 60. Number 4, and this one is a true emergency, swelling of your face, your lips, your tongue, or your throat, because this can be a rare but life-threatening reaction to lisinopril called angioedema, and you call 911 immediately, you do not wait. Number 5, your urine output suddenly drops significantly over 1 or 2 days. And number 6, An extreme overwhelming fatigue that came on suddenly and feels completely different from your normal tiredness. Any single one of these 6 signs means you pick up the phone and call your doctor today, not tomorrow, not after the weekend, today. Because you have worked too hard and lived too fully to let something preventable catch you by surprise. Remember Dorothy, that 69-year-old librarian from Nashville who was dizzy, coughing, swollen, and scared? She brought everything she learned to her next appointment, asked the right questions, got her potassium tested. It was borderline high, caught just in time. Her doctor switched her from Lisinopril to Losartan. The cough disappeared in 3 weeks. Her dose was adjusted. The dizziness stopped. And last I heard, she was back leading her Thursday night book club like nothing ever happened. That is what being informed does for you. That is exactly why this channel exists. Next week I am sharing the 5 breakfast foods seniors on blood pressure medication need to stop eating immediately, and number 3 will genuinely surprise you. Subscribe right now, drop a comment telling me which of these 9 things surprised you most, and I will see you next video.